Good morning, you guys. It is Thursday morning. It is the day before my test, and I've been here. It's 6:30. Yeah, 6:28 a.m. You probably can't even see that. How cute are those boys, right? I can't even handle it. Okay, yeah. Anyways, it's 6:30. I've been sitting here at this desk studying all morning. Let me show you the aftermath. Ooh, it's a mess. So I have my wills, eye manual that I've been using, my computer I've been taking notes, my dinner from last night, and some snacks. And then I didn't really bring any notepads, so I've been like using these Holiday Inn pieces of paper like crazy. So whatever works, man. And then I've just been taking notes on my computer too if I don't want to write something down. But sometimes I want to write stuff down, so I've been doing that. I've been going over the Retina section in wills. And so basically I've just kind of looked at each diagnosis. Okay, so each diagnosis, like macular hole, has its own little section and photos and whatever. So I've just been looking at each of the diagnoses and then trying to say everything I can think about them. And yeah, like going through the book, looking at the photos, and yeah, doing that with the Retina section. So then this morning we have an optics review at 6:45, so I'm gonna head down there in just a few minutes, and that goes until 8, and then at 8 o'clock is my second mock oral. I'm the first one of the day in the Retina section. And you know, I was feeling pretty good. I was feeling okay until yesterday. I did a little Skype study session with one of my friends who was the fellow at Cornell in cornea last year, and we were Skyping, and I just felt like I was kind of floundering. I don't know if I was tired or what, but I felt like I just kind of like wasn't keeping as good of an organization as I had been, and I was missing stuff. And he was asking me like, what syndrome do you think that's associated with? And I was like, I don't know, man. They were hard, but they weren't hard. They were normal topics he was giving me. So that made me a little nervous. That made me feel just a little bit uneasy, because up until that point I felt like I'd been doing okay. So I think my goal today is going to be to do optics in the morning, Retina in the afternoon, and then I need to check out of the hotel. I haven't decided if I'm going to stay at the course any longer or if I'm just going to check out and go on my own. I kind of feel like at this point I maybe just need to do some more content review on my own, and so I think I might just keep going through my wills and making sure that I know all the big stuff for the big topics. Like this is a good one, like these pupils. Like the difference between Argyll-Robertson and Hutchinson's pupil, or an Addy's tonic pupil, which I feel like I know pupils, but I don't know. Yesterday, Steven asked me, like, it was a Fuchs, heterochromic iridocyclitis question, and I knew it was Fuchs, but then I started saying stuff about ICE syndrome, and I don't know why I like always get those confused, and not confused in my head, but I just lump them together. Like I keep them in the same category. I don't know why. Maybe because they both get glaucoma, or they're both like weird, or I don't know, whatever. And so I started saying something, and then I was like, wait, no, that's not Fuchs, never mind. And I just don't want to do that on exam day, so that makes me a little nervous. But anyways, that's the status. It's only one more day until this is out of my life, and hopefully I pass, and then can just be done with it. Be done, boards. So anyways, that's that. I will see you guys after I've done my mock oral in Retina. Wish me luck. Yeah, I'll see you later. Bye. Hey you guys. Let's see, it's 10. I'm back in the room. I did my Retina practice, my like mock oral. It went okay. I was super nervous. I was like ridiculously nervous, which is interesting. Makes me scared for tomorrow. Like I hope I can calm down and not be that nervous. I got through 6 cases, and he let me do 3, and then he interrupted and he went through the first 3 with like tidbits and extra information and like things to add and how I did, and then I got through 3 more, and then he stopped me and reviewed those 3, and then the time was up. And so I think that I probably could have gotten through at least 1 or 2 more if he hadn't have stopped me those 2 times. So I think that'd be 7 or 8 cases, which is a little on the slow end. I would rather be at like 8, 9, 10 cases. They were really hard. He basically said, because it's the last day, he was like, okay, I have 100 cases. He's like, I've gone through almost all of them. He's like, I have 10 that I haven't done. So we're gonna do those, and then we'll like pick and choose some high yield ones. So the 10 that were remaining are like the weird random ones that aren't like super common, super high yield. He even said, he's like, this one's not very high yield. So my first one was like Arcus, or not Arcus, was like lipid retinitis or lipidemia retinalis or whatever, where the blood vessels in the retina are like white because they're full of triglycerides, and like hypercholesterolemia, hyperlipidemia. And the prompt was like 40-year-old with normal vision who was referred to you because the vessels in her eyes look funny. And the photo was kind of like the color was desaturated. The vessels were not like stark white. I kind of thought it was either like sheathing, like an inflammatory condition, or I thought it was the lipemia retinalis, which I didn't know the name for it. I just said this could be like high triglycerides that you're seeing in the retinal vessels, and I would make sure that she sees her PCP right away to get like cholesterol and lipid management, blood pressure, A1C, like that kind of stuff. The big point there with that one is that they're at really high risk for MI, early MI, and this could be like potentially like life-threatening. So I think I just needed to stress that it's like super important for them to be seen right away. Then my next one was a sclopteria or sclopatera, which I knew what it was. I said what it was, but it was just kind of like a huge injury to the eye, and so that was whatever. The next one was a non-accidental trauma, which was okay, but it was only one eye, not two, and then he didn't give me anything else, so that was all fine. And then one was the branch retinal vein occlusion, which was fine. And then what was the last one? Oh, a melanocytoma. It was a melanocytoma at the nerve, which was also like a little atypical, and it had a OCT angiography and OCTA, which I don't know anything about OCTA. I'm plastics, I don't do retina, and when I was in residency, like OCTA was just coming out. It's a very new technology within the past few years, and so I was just like, this is an OCTA that is consistent with a melanocytoma. Like, I didn't know what to say at all. So that was, but I mean, I got all the diagnoses, so I think that's good. There were just like little tidbits that I could have thrown in, so it makes me feel better. But I don't know, guys, I'm just still like ridiculously nervous. I think right now I feel okay about the structure and the format of the exam, and really my biggest concern is just the content, like making sure I know stuff. And so I kind of don't really want to go to any more sessions. I kind of just want to review material for the rest of the day. And now I'm trying to decide, it's 10, lunch is at noon. I'm trying to decide if I should pack up and stay till lunch and then go to the hotel, or if I should just check out and go to the other hotel and like go to Whole Foods and get a healthy lunch, because the lunches here are like okay, but they're not super healthy, you know. So I could go get something that would make me feel like maybe a little bit better, but I'm still gonna need to get dinner tonight. I could go to Whole Foods for dinner. Okay, I think that's what I'm gonna do. I'm gonna pack up, then I'm gonna study here until lunchtime, because checkout's at noon anyway, so I'll pack up, I'll study till like 11:30, 11:45, check out, go to lunch, then I'll leave, go to the other hotel, and then I'll study, work out, go to Whole Foods, go to bed. That's my plan. Okay, I'm gonna pack up the room now, I think. Okay, things I'm going to get head imaging for. Anything in the neuro orbit room, any phacomatoses, yeah, and many white dot syndromes, and lymphoma, vitreoretinal, obviously, orbital, and syphilis, and retinoblastoma, but not a CT. I'm gonna get an MRI. And what else am I gonna get neuroimaging for? Those are the big things. Okay, anything in the retina room, I'm gonna get OCT, FA, ICG. Can I just say all those things? I probably shouldn't always say ICG. Really the only one where ICG would help me is polypoidal, and that's gonna be a pigmented elderly person with CNV. Then I'm gonna get an ICG, and then I'll see the polyps, and then it's polypoidal. And then you laser those. No, I don't know. Maybe you inject them. I don't even know. Why am I doing this? You guys, it is 10:54, which means that in 12 hours and 6 minutes, I mean not 12, 24 hours and 6 minutes, I will be done with my oral boards. As long as I pass them. As long as I pass them. Gonna pass. Gonna pass. It's totally fine. I just need to not be so nervous. I really think I just need to not be so nervous. That didn't take very long. So getting all packed up. Whew, pack it up. And I don't know, guys. I'm just like in such a weird headspace. I'm like really nervous. I don't know what to think. I don't know what's going on in my life. No, I'm just kidding. It's fine. It's all fine. Totally fine. Okay, so I'm pretty packed up. I'm gonna just pack up a few extra things so I don't forget, like my AirPods. That would be suboptimal. And then let me get out my computer and my last time sitting at this ridiculous desk. Okay, so I'm gonna do an hour, 1 hour of a review from Will's. So I'm gonna do, I feel like I've done a lot of posterior segment, so I think I might do, God, I could do chemical, there's so many things I should do. You know what I really need to do, what I absolutely just like hate, is glaucoma. I hate glaucoma. I don't know why. I don't get it. It seems so simple to me, and then I get it all wrong. It's been my lowest score on everything always. Isn't that funny? This is where you get to the point where it's like, do I know what I know? No. I don't even know what I don't know. What to know, who to know, what to know. I'm freaking out. They said that this is the day that everybody freaks out, and here I am, freaking out. Hello, I made it to the Westin. I'm in a new hotel room, and I just checked in. I have double beds tonight. This hotel is so much nicer than the Holiday Inn in Skokie. I love a Westin. I'm like such a Marriott loyal person. So I'm like freaking out. I'm feeling super stressed. I don't know why suddenly it's hitting me. I'm gonna set you right here. But yeah, suddenly I'm feeling like ridiculously stressed. So I'm going to unpack my suits like I did before, and I guess I can just grab them right here. I'm super happy because this hotel does have a robe, and I think I mentioned I love a hotel with a robe. So I'll bring you into the bathroom. I saw the robe here, and I was so happy. Like, yes, something good. So I'm gonna grab, just turning on some lights. I'm gonna grab some hangers. It does feel really nice to be here at the hotel, like in the place where the exam is gonna be. The check-in for the exam is tonight. I think it's at like 5. It might be 5 to 7 or something like that. So I'm going to study here for a little bit. then work out. I had lunch at the other hotel because it's included in the price of the course, so I might as well take advantage of that. So I had lunch. It's actually pretty good. The food there, I'm like pleasantly surprised. They did a really good job with the food. There were vegetarian options for every meal, which is really nice. They actually had Indian food for like every meal as an option, and then they had either like chicken or like pasta or something else. So, and salad and whatever. So not too bad. So I had lunch. I'm gonna study for a little bit, and then I'm gonna work out, and then I will freshen up, go downstairs, register, sign in for my exam, and then try to sleep. It's actually probably a good thing that I went to bed a little bit later than I wanted to last night, because I'm gonna be really tired tonight, and then maybe I'll sleep, hopefully. I generally sleep okay, but I'm telling you guys, I feel so nervous. I have like a pit in my stomach. My heart's beating fast. I feel like physically anxious and really nervous, so. Hello, my friends. It is 3:36 on Thursday, the day before my oral boards. I'm freaking out, like freaking out. No, I'm okay. I'm gonna go to the gym. I've been studying, I've been at my desk, I have my little setup, I've been going through cases. I finished going through the posterior and anterior segment of both Friedman and Pemberton, which I've already been through Pemberton, but I went through it again, and I went through Friedman. I've gone through peds. I've gone through external in Pemberton, but not Friedman. I might look over external. I feel like there's some of the plastic stuff where it's like I almost know too much, or I'm gonna say too much or say something that they don't want me to say because it's my specialty, and I would say like I need to think more like a comprehensive ophthalmologist in terms of the plastic stuff. So that's something. Anyways, I've also been making a list of topics that I feel weak on. So, or at least ones that I want to like have a really canned spiel for. So I'll show you my list. Unclear if you guys can see that or not. There you go. You can probably see it now. So acanthamoeba, I just want to review again. Diabetes, AMD, I just want to practice my spiel so that I can say it really fast. And then I can't read what these other ones are, but they're all stuff that I want to go over. Oh yeah, albinism. Oh, I did the glaucoma one, so I can delete that. Whoop, deleting that. Okay, and then the other ones. So those are what I'm gonna go through tonight. I'm gonna go to the gym right now, clear my head. I made a coffee, so I'm drinking that. And then gonna go to the gym now. I'm gonna order dinner. Actually the menu, the restaurant menu here looks so much better than the one at the Holiday Inn. And so I'm really excited about that. And I think I'm like blowing up here. And I think I also might order breakfast in the morning, like room service for a planned breakfast in the morning. And that's where I'm at. So I will see you after my workout. Bye. Hello, hello, I'm back at it. I went to the gym, I worked out. I just kind of freshened up a little because I'm gonna go downstairs in like 10 minutes. Then I'm gonna take a shower, order dinner, and like get completely ready for bed. I'm studying a little bit more now. I was looking at my list of things that I wanted to go over, and one of them was albinism. And so I just reviewed albinism, and I wanted to give you guys some tidbits. So you know that there's two different types of albinism. There's ocular albinism and oculocutaneous albinism. And the way you can tell the difference is that in ocular albinism, which is just confined to the eye, so they're not going to have skin pigmentation like what you would think of with regular albinism, but it's a problem with the melanosomes. And whereas ocular cutaneous albinism is a problem with the amount of melanin in the melanosomes. And the way I remember that is because melanosomes have a big O for ocular, and the other one doesn't. So ocular melanosomes, that's what I remember. And then if you have the oculocutaneous albinism, there's two types. There's tyrosinase positive and tyrosinase negative. And tyrosinase is an enzyme. And if you're positive, then you get pigment that increases as you age. So they can get a little bit of pigmentation. And if you're negative, then you got no pigment. U negative, no pigment. So that's how I remember those. And then there's 2 lethal forms of albinism that you must refer patients to either hematology oncology or I guess mostly hematologists would deal with this, because there's Hermansky-Pudlak, which is a problem with platelets, and they get thrombocytopenia and they can have bleeding problems. And then the other one is Chedek-Higashi, if I'm saying that wrong, please correct me. And that's a problem with anemia, neutropenia, and they can get leukemia and lymphoma. And so those are the big things that you need to keep in mind. And then also the patients I knew they got foveal hypoplasia and that they would have low vision. And so when I was doing my little practice test, I recommended having them follow up with a low vision specialist, and that I could prescribe low vision aids like increased bifocal ads or telescopes that they could use, or like tablets with better contrast sensitivity or whatever. So that's something. But then the other things that I forgot are exam findings. So they can have nystagmus, they can have strabismus, and they're generally high myopes. So those are all the big albinism things. And then you know what you would see on exam, like TIDs, transillumination defects in the iris, and then a very blonde fundus where you can see all the underlying choroidal vasculature. So I'll scroll through this case and just show you so you can see. So here's the case that I just did. And so basically it says a 19-year-old college student sees you for a new glasses prescription, and this is what you see. So you describe that this is a very blonde fundus. You can see all of the underlying choroidal vasculature. The fovea looks hypoplastic. You don't see a foveal reflex or any really definition in the fovea here. The nerve actually looks a little hypoplastic to me as well. And the vasculature looks relatively normal. And then they show you another photo. So this is extensive iris transillumination defects. You can actually see the edge of the lens here because the iris is so non-pigmented or hypopigmented that you can just see right through it. So that's that. And then they have a really nice explanation of albinism and all the things that we kind of talked about. So that was a super good review. I'm really glad that I did that. I'm going to cross that one off my list. And let's look at the other ones that I need to keep going through. I'm cozy in my robe. I took a shower. I'm clean. I'm gonna wear this robe all night. I'm so excited. I've been doing a little bit more questions. Actually, just did a really hard one that's interstitial keratitis with syphilis, which I know is a thing, except that this did not look like interstitial keratitis to me at all. I'll show you guys the picture. Right? So I saw this and I was going for like a corneal dystrophy or something. I thought it was like gelatinous drop-like or something else, but apparently it's syphilis and interstitial keratitis. So that's a problem. So I need to work on that one. But anyways, let me straighten this out. So my dinner just got here. I ordered salmon. Yum, so healthy. Like it's like salmon and couscous maybe, or quinoa, I don't even remember, and some kind of vegetable. Looks really good. So that's my dinner plan. I'm just gonna set that right there. And I also got a Perrier because I'm just living large, or Pellegrino, night before my exam. So I'm gonna do that. I'm gonna enjoy my dinner, you guys. And I think my plan is, come talk to you in my robe. I think my plan is to probably go to bed soon. I might do like one more case. Then I'm gonna get up at like 5, study from 5 to 6, get ready from 6 to 7, eat breakfast from 7 to 7:30, and then I have to be at my exam at 7:45. I'm ready to go. Ready to go. See you in the morning. It's over! You guys, it's over. I took my oral boards and I really hope I don't have to take it again. I'm super happy that it's over, and it's over. That's the only thing I have to say. Yeah, I mean, it was like just like what everybody told us it was gonna be like. It was very well run. Sorry, my camera just died. I feel like such a YouTuber saying my camera just died. No, but anyways, it was very well run, very well organized. There were 6 rooms. The people were super, super nice. It was hard. I was really nervous, I feel like I prepared. There were a few things that I definitely didn't know, but I don't know if I would have known them even if I'd studied more. There was one like surgical thing I didn't know, and they kept asking me. They kept like reading the question over and over again, and I was like, I don't know. I do not know. But everything else I felt like I knew. They kind of like progressed the questions really quickly, so like I wouldn't get done saying all the things and then they would go on to the next question, and then I would be like, wait, but I would do like a, you know, dilated fundus exam, like, you know, stuff like that. But I feel like since they moved on to the next question, that must mean that I like collected all the points for that question or passed it, or I don't know how it works. I have no idea how it works. But anyways, let me show you what I wore. I ended up wearing my navy blue suit because I tried on my black. I almost wore the black one, but I didn't really like the suit, or I mean the pants for the black one. So let me show you here. So this is me. So I just wore my hair straight down, and I just tried to keep it back so I wouldn't touch it. I'm wearing just a white blouse, and then a navy blue jacket, navy blue pants, and just regular heels. And then this is my little name tag. So now it is over. I'm gonna call everybody and not talk about the exam because you're not allowed to do that. And then I'm gonna work on a research project for a while, and then I kind of want to go shopping is what I really want to do. And I'm gonna see my friend Kelly and go home tomorrow. So that'll be good. Thanks for following along, guys. I will find out my score in 6 to 8 weeks. Or not my score. I'll find out if I passed in 6 to 8 weeks. We'll see. We'll see what happens.